Hello, my name is Anchal.
And I'm Natalie.
And welcome to the PFAS Chronicles. In recent years, public health advocates and scientists have raised awareness on the class of chemicals known as PFAS, or per and polyfluoroalkyl substances, also known as forever chemicals. In this 5-part series, we'll take our listeners on a deep dive into the history of PFAS. We will discuss what we currently know about them, how they harm our health, and what actions scientists are taking to remove them from the environment. We'll hear from key scientists in major institutions across the U.S. on all things PFAS related. We will also hear from advocates and community members to understand how we can both advocate for and protect public health. Stay tuned for more.
In today's episode, we'll discuss the origins of PFAS, the scientists who discovered the chemicals, and historical and environmental disasters involving them. We'll hear from Phil Brown, University Distinguished Professor of Sociology and Health Sciences at Northeastern University in Boston, Massachusetts, where he directs the Social Science Environmental Health Research Institute.
Hi, Phil. Welcome to the conversation.
Hi, glad to be here.
Our first questions for you are, what are PFAS and when and by whom were they discovered?
So PFAS are a very interesting group of chemicals. They're probably somewhere between 15 and 16,000 different forms of PFAS, and more are discovered all the time. And they've been around for a long time. Unfortunately, most of the problems with them have also been known for a long time, and not much was done about them. But they were discovered way back in the 1930s, and they've had a lot of interesting properties, and some of these were discovered accidentally. But some of the research on PFAS were in terms of making nuclear weapons even. So they go back to World War II and before. Probably about 1938, DuPont and 3M were starting to discover these and figure out uses for them. And like many other chemicals, after World War II, there was a vast explosion of chemical usage in a lot of products, and they kept finding more and more uses for these chemicals. So they just expanded. And still today, every week, every so often, we should see and hear about new uses for them that we hadn't thought about before, new places where they're going to turn up.
What are the most common ways to be exposed to PFAS? And what are the different routes of exposure?
Well, people are exposed in a lot of different ways. One of the things that people hear about the most is in drinking water, because there's been so much attention to that and to the setting of regulations for how much can be allowed in drinking water. But people are exposed in a lot of other ways, from food, both because of the food packaging, which has a lot of PFAS in it, and also because a lot of food is grown on agricultural land or comes from animals like cows that are feeding on agricultural products that are fertilized with sludge that come out of wastewater treatment plants, where the accumulation of PFAS that's already in the water in the waste stream is amplified. And then when that's used as sludge, it's into the crops and into the animals. But they're also exposed through products that they use all the time, personal care products. And that could mean menstrual products, it could mean tooth floss, it could mean cosmetics, many different things, grease-proof food packaging, all sorts of things. And of course, firefighting foams, which have become one of the major sources. People can be exposed by eating, they can be exposed by drinking, they can be exposed by air emissions. So there's so many routes because there are so many PFAS and they're so extensive throughout the whole country, throughout the whole world.
What are the current strategies scientists are employing to understand exposure to PFAS, and how have communities contributed to this effort?
Well, first thing to do is to find out how widespread the exposure is. We do that through a lot of ways. One, we sometimes pick particular communities that we know are already contaminated because of an industrial plant. So a very important thing like the DuPont plant in Parkersburg, West Virginia, where they, in 1999, faced their first lawsuit from a farmer, the family of the tenants that lived next door, and sold some of their land for DuPont to dump waste on it. All their cows died. And so they sued. And then it turned out that, well, DuPont had contaminated the water for tens of thousands of people who live nearby in different small rural water systems. And that became a big class action lawsuit. And that was probably the first thing that put PFAS on the radar. This was just one of the particular chemicals, PFOA. And that was a very landmark decision, not only because it gave some attention and results financially to the affected people, but because it funded the first very large research study that showed how widespread these chemicals were in people's bodies and their links to different health effects. So that really spurred a lot of other research, and that's become just monumental since then. So people had to know that exposure. The CDC's NHANES biomonitoring project found a very large percentage of the population, virtually everybody, 98% had PFAS in their blood. That alarmed people. The more that states started to test the water, the more they found, the more the military talked about, well, we have all these bases full of the firefighting foam. Every time more was found out, the scientists and the state agencies and the federal agencies could go in and do research to find out more about the exposure. Once you find the exposure, then you say, well, do we need these products? Can we have something in their place? Do we really need the use of PFAS in cosmetics? Do we really need it in things we use every day? Do we need to have it in the waterproofing on our fabric or on the clothes that we wear? So we've discovered lots of alternatives, and scientists and engineers spend a lot of time trying to figure out green chemistry, safer ways to do things, and also just to keep it out of the upstream area. We don't want to have to remediate it downstream. So we've had a lot of success. A lot of the work has been people pushing companies to stop selling products with PFAS and to make sure that the suppliers for those companies don't have PFAS in products that are further down the supply chain.
So going off of our last question, I think it's important to talk about science communication with the public. But why is it so important in the context of PFAS?
Because in a very short time span, a lot of research occurred to show how widespread these chemicals were. A lot of lawsuits were filed and settled, not just the one about DuPont I mentioned, but with 3M, with Solvay, with other chemical companies, with companies that take these products and remanufacture other things with them. The explosion of knowledge about how many military bases and airports and fire training academies have them, ordinary fire departments. Some states began to do widespread testing of water, of sludge. States began to make regulations. So in a very short period of time, there was a monumental interest in this. And people hearing about how widespread these were never thought that a particular class of chemicals could be used in so many different things that they ate and used and were surrounded by in buildings that they worked and lived in. And so this accumulation of so many pieces of knowledge really just conglomerated it at one time.
What are scientists and advocacy organizations doing to communicate PFAS risk to the public?
Me and a lot of colleagues, both in science and in advocacy groups, were involved in the National Academies of Science, Engineering, and Medicine committee that looked at this and published a report a couple of years back. And that report was very important because it talked about the need for medical monitoring and for blood testing, which is something that a lot of the affected communities were very concerned about. They also pointed to the fact that most medical providers don't know enough about PFAS, so that when people in the affected areas come to them and say, what do I do? They don't know. So there's been a lot of work, and our PFAS Project Lab here at Northeastern has been doing a lot of this work, trying to educate more physicians. So we've worked with a number of colleagues to develop a continuing medical education course so that we can teach physicians as well as others what they need to know. We published a lot of things on our website about what you need to know, how to order blood tests, how to interpret what results you get from blood and from water, and how to talk to your doctor about these things. So more public education of that sort is necessary. And a lot of states have started to do this in their statewide task forces, in various laws they've passed, in providing funds for education, putting information on their websites. Mainly, I think you find that it's the environmental groups, ranging from the very small groups that make up the National PFAS Contamination Coalition to some of the very large nationwide groups like the Environmental Working Group, and research centers like Silent Spring Institute. These are the folks who've really done most of the work in education for the public as well as for clinicians. So the states and the federal government have a lot to catch up on. And in fact, people were very alarmed because recently the Agency for Toxic Substances and Disease Registry, part of CDC, came out with their updated medical guidance, and they did not follow the recommendations of the National Academy's report, even though they actually funded it. They still didn't come up with the recommendations to do blood testing and medical monitoring.
What's next in PFAS research, and how can we highlight marginalized communities and the need for environmental justice?
So we've had a number of grants from the National Science Foundation and the National Institute of Environmental Health Sciences, and we've been able to look at lots of different things. We've looked at the way that the science was discovered. We've looked at the way that activism developed. We had a whole grant on that. We interviewed activists around the country. We developed a database of all known contamination sites, and we later expanded that to suspected contamination sites based on the kinds of industrial or other activity conducted there. With another grant, we developed a governance database looking at all the state and federal action of all sorts on PFAS. And we've used that to build a lot of analyses. We've used that, for instance, in a paper that came out just last week in the American Journal of Public Health to show that carceral facilities were located in proximity to PFAS contamination sites. And so that really affects prison health. We have a use of that database to look at other kinds of environmental justice issues. We have the ability to map this. So we've got a map on our website and also on the PFAS Exchange website that we do with our colleagues at Silent Spring Institute, in which we are able to show the proximity of tribal boundaries to PFAS contamination sites. We've helped colleagues in Europe develop a similar map of many European countries to see where the contamination sites are there. So we're always trying to find new ways to map this process, all the different parts of the PFAS contamination crisis, and to work with lots of different community groups. As I said before, there are a lot of groups in the National PFAS Contamination Coalition. We've been pleased particularly to work with the Massachusetts Breast Cancer Coalition and with Testing for Peas. We have run 3, and now in June we'll have our 4th national conference, which brings together journalists, scientists, government people, activists, all with an agenda driven by the community groups that are most affected.
How can individuals participate in PFAS advocacy within their communities?
Well, it ranges from the very small scale to the national scale. We have here in Massachusetts dozens of community groups that are fighting against putting in artificial turf fields that are full of PFAS.
Mm-hmm.
We have people on the national level trying to get federal regulations passed. On the state level, we have people being very effective at state level regulations and monitoring, and even programs to reimburse farmers who have to stop farming because their land has been so contaminated. Every place you look, you find PFAS, and that also gives you opportunities to do work. And there are so many state government officials who are happy to do this. There are organizations of all sorts in the medical field, in the scientific field that are doing research here. So it's a matter of looking around and finding out where these products are, how to make sure that airports and fire training sites use fluorine-free firefighting foam, and that we find ways to engineer new processes that don't use PFAS, because they are used in so many different things that people never think about. I mean, we've not even talked about, for instance, how much PFAS there is in plastics. So if we reduce plastics, which is another big environmental issue in general, we're going to have a lot less PFAS.
Do you have any final thoughts for our listeners today?
Well, I think that PFAS interest and action is a bit of a gateway to so many other things, because people have been so aware of it and have seen so much action. This is also a kind of way to jumpstart lots of other things too. So, increasing the amount of chemicals that are studied by EPA and regulated through the Toxic Substances and Control Act. Ways to look at some new emerging contaminants that haven't been that well studied as much before, like 1,4-dioxane. Ways to look at very common and ordinary things like the amount of chemicals coming off of crumb rubber in playing fields or of tires as the cars and trucks roll over the roads. It just alerts us to the fact that toxics are not just something that are produced in a chemical factory somewhere far away, but that they're around us all the time, and that we have to always be alert and understand that there are chemical companies and other companies out there that are making a lot of money with these products and are not having any kind of end responsibility for the results of it. So I think it really heightens people's awareness of why they need to take action on scientific and advocacy and governmental and legal levels.
Thank you so much to Phil Brown for joining us, and thank you for listening. In our next episode, we will be joined by Dr. Catherine Manns, where we will be chatting about the science behind the detection of PFAS. See you there. This podcast serves as a companion to the textbook Environmental Health: Foundations for Public Health. Podcast episodes were written by Anchal Malh and Natalie Conti, with support from Natalie Sampson, Lindsay Talon, and Natasha DeJarnette. Production support has been provided by Justin Schell and Erica Irvin at the Shapiro Design Lab at the University of Michigan. Editing support has been provided by Springer Publishing.
The PFAS Chronicles podcast series has been brought to you by Springer Publishing Company, LLC. All rights reserved. No part of this podcast series may be reproduced, stored in a retrieval system, or transmitted in any form or by any means without the prior permission of Springer Publishing Company, LLC.